Yes, it's peaceful. Were you feeling that way when you came in? No. Okay. Thank you. Humans, since music's origins, have used music to influence and alter states of being. In Hinduism, music is considered cosmic vibration. The Om, or crown chakra, is used to symbolize the beginning and the end of a mantra or prayer. It's also used in yoga to center oneself and to focus. In numerology, certain numbers are associated with specific sound frequencies. Emitting that sound frequency will give off certain qualities that are associated with a number. Music is even used for social ceremonies. How many times at a wedding have you heard "Here Comes the Bride"? Or at a presidential inauguration, "Hail to the Chief," to symbolize the new chief. Or even DJs at parties, playing party music, symbolizing that there's a celebration going on. Since humans integrate music so much into their daily lives, why not use music to improve human health and well-being? Why not use music as a therapy? Most alternative forms of therapy are given a bad rap. They are viewed as radical practice, ineffective, and having little medical relevance. Music therapy should be an exception to this bias, however. Today I am going to talk to you about how music became a form of therapy and what music therapy is. I will also address the criticisms of music therapy and reveal the true limits of music therapy as a healthcare profession. Lastly, I will tell you why you should find out more about music therapy and how you can support this important health practice. Let's first take a look at how music therapy has evolved into a therapeutic practice. Music has been applied to medicine specifically since ancient civilization. Pythagoras established the Greek theory of the four humors. Many people do not know that this also included music. He believed that music was important to balance the body. This is where we actually get the four components of chorus, which is soprano, alto, tenor, bass, is from that theory. In the colonial industrial era, discoveries were being made about how music had physiological effects on the body, such as its steady circulation, rhythmic pace, how it increases respiration and increases heart rate. In the 1950s, French doctor Alfred Tomatis discovered in utero hearing. He was the first to develop a technique called sonic rebirth, and the first to successfully treat autism through sound therapy. Let's take a look at some of the misconstrued facts about music therapy. The National Association for Music Therapy was founded in 1950. This marks the beginning of music therapy as a certified healthcare profession. Music therapy, however, faces criticism of its relevance in the healthcare industry. How can music therapy be a practical treatment? Listening to music cannot make everyone feel better. No, listening will not make everyone feel better. However, listening to music is a very small component of what music therapy is. Techniques such as musical improvisation and guided imagery in music are utilized to draw out and facilitate emotional connections and behavioral changes. These have been found to successfully treat a variety of conditions. Improvisation is commonly used, in fact, to treat autism. Juliette Alvin, author of Music Therapy for the Autistic Child, described the effects of improvisation in one particular case that she had of a boy named Oliver. In the beginning of her case, she describes Oliver as being thus: "He scarcely spoke. He experienced no satisfaction from any manual activity and showed no sense of achievement." Later on, after utilizing musical improvisation in her therapeutic treatment, she describes him as such: "At first the result of his hands striking the keys was chaotic, very unrhythmical, and lacking harmonic resonances. But the use of the keyboard produced other results. an awareness of control and of individual fingers, independent of his two hands, the use of a considerable territory of keys at his disposal. It made him lose his inhibitions within the framework of an easy physical activity. Improvisation helped Oliver to gain a sense of control and a sense of enjoyment by producing a sound that was pleasurable to him, and it was of his own doing. Another criticism is that music does not have powerful enough effects to eliminate conditions and symptoms. This is true. However, music therapy is not designed for the purpose of curing diseases. Florence Tyson, former president of the Mid-Atlantic region of the National Association for Music Therapy, defines music therapy as the scientific application of music as directed by the therapist in a therapeutic environment to influence changes in disability or behavior. This means that music therapy is used as an assistive treatment to aid in the healing process. One long-term study determined that this is the case with schizophrenia. The study showed that those schizophrenic patients who were treated with music therapy in combination with standard care showed improvement in their total symptoms by 9 points. As you can see on this chart, this is a great difference from those who received just standard care, only improved by 2.96 points overall. This is very statistically significant. The strength of music therapy is in its cooperation with other biological treatments, not in place of. The therapeutic effects of music cannot be standardly measured. This is also true. However, this does not make music therapy's effects immeasurable. Music therapy is based upon the individual being treated. Therefore, music therapy's effectiveness lends itself to more qualitative forms of measurement, such as behavioral observation in randomized control trials, as opposed to a standard scale. Behavioral observation involves observing and analyzing the progression of an individual case. This practice allows a music therapist to directly interpret what kinds of effects the therapy is having on a patient. Randomized control trials involve computerized random assignment of subjects to variable groups, double-blinding the conductors and the subjects, and maintaining that blindness until after the results are in and interpreted. The reason for this practice is that extraneous variables are basically eliminated by maintaining that blindness, and it establishes more of a cause and effect relationship as opposed to a corollary one. Therefore, you can take something as subjective as music therapy, which is based on the individual, and do a broad-scale study of it. You can have multiple patients at once being analyzed through randomized control trials. Music therapy is measurable, but that's from case to case. The effects would be less clear if you had some sort of scale, had some sort of quantification as opposed to qualification. Let's review the facts about music therapy.